My name is Tricia Wonderly, and I'm a dental hygienist. I've been practicing for almost 30 years. Gum disease is inflammation, and your mouth is the gateway to the rest of your body. So by properly flossing every day, you have a greater opportunity for overall health and a longer life. So when you start to floss your teeth, you want to take an arm's length of floss. I always wrap my floss around my middle finger, and the reason why is if you use your index finger, which is what most people naturally tend to do, you have a much harder time getting your back teeth. So if you try wrapping it around your middle finger first, on both your right and your left hand, so that it won't fall off, and then wrap the rest of it lightly around one of your hands, and it doesn't matter which one, until you have about 5 inches between your fingers. Then you'll tuck your fingers in, this will be your anchor, and you'll use your index fingers and your thumbs to guide the floss. You're going to slide these so there's about 1 inch between your fingertips. Then you're going to go ahead and place it in your mouth. When I go to the back, I might give myself a longer piece of slack so I can put my fingers all the way behind the back of the last tooth. The most important part of flossing is once you get the floss between the teeth, you have to wrap the floss in a C shape around the front of this tooth. Then you want to take your fingers and you want to bring it back so that your fingers are touching both the cheek side and the tongue side of the tooth. So just make sure you're constantly reminding yourself to tuck it in and then go down, scrape it up. So you're going to be sliding it down underneath the gum line until you feel that resistance where the gum line stops the floss. Then scrape it up and go down about 7 times on one side of one tooth. Once you get one side of one tooth done, hug it intentionally very closely to the back side of the other tooth. Again, go down underneath the gum line all the way until it stops. You can either go back and forth 7 times, or you can go down and up 7 times, scraping that plaque layer right off the side of the tooth, and then come out of that side. And you're going to do that between every single tooth. After you've done 1 or 2 teeth, as you can see, you'll have some plaque, so you wrap it up, and you take a new clean piece off, and you'll work your way down the whole line of floss. As you go around your mouth, you're going to come to the center teeth, and at that point, you're going to want to switch hands so they don't get tangled up. When you do your upper teeth, it's a little different. I primarily am going to use my index fingers and my thumbs, whereas on the lowers, I almost exclusively use my index fingers. So on the upper teeth, I'll start out by having the thumb using the floss to wrap around the tooth on the cheek side, and either the thumb or the index finger on the roof of your mouth side. A habit that takes 5 minutes a day can add years to your life, and it can reduce your risk for heart attacks, strokes, diabetes, arthritis, low birth weight children, and even Alzheimer's disease. A 2012 study states that brushing and flossing your teeth is the simplest and cheapest way to a long life. So neglecting proper flossing and brushing can actually be fatal. Never flossing or ineffectively flossing hiked mortality by 30% versus daily flossing your teeth. Thanks for watching. I hope this was helpful, and I would encourage you to floss every day, and don't forget to see your dental professional at least twice a year.